a graying tower alone on the sea. You became the light on the dark side of me. Love remains the drug that's high enough to feel.
Populations with Special Health Needs, Part 1 by Professor Tammy. Vulnerable population. Certain populations in the United States face greater challenges in accessing timely and needed health care services. What do they need? Do they need masks? Do they need medicine? Do they need bandages? Are they getting them on time? They are at risk for poor physical, psychological, and or social health because they are all intertwined with each other, these different health aspects of a person. Vulnerable population are called underserved population, medically underserved, medically disadvantaged, underprivileged, American underclasses. So these are other names for vulnerable population. Sometimes they're also called special population. Vulnerable status affects unequal social, economic, health, geographic, beliefs, resources, and behaviors. There are 3 different characteristics that we will be looking at: predisposing, enabling, and need characteristics. And we have to think about, how do vulnerable people, how are they affected? And how are they treated in healthcare? Do they have poor access to healthcare, lower quality, or are they treated more like inferior with the health status versus someone who doesn't have these vulnerabilities or have fewer vulnerabilities? So let's take a look at predisposing characteristics. Race, ethnic characteristic, minority group. Is it the language? Even though someone may be able to speak Spanish or Chinese, are they from the same area? Do they use the words the same? Do they have similar cultures? Are you using the language in a colloquial way versus in a textbook way too? Do you understand the culture of your patients? Gender and age, these tend to be people in the vulnerable group: children, women, pregnant women, elderly, LGBTQIA. LGBTQIA, sometimes you might have heard it LGBT or LGBTQ, but let me explain what this all stands for: lesbian, gay, bisexual, transgender, queer, intersex, and asexual. And this is a group that a lot of people don't understand, and it's really important to be compassionate. Geographic location, sometimes you don't have a choice of where you live. Rural areas, sometimes it is difficult to maybe take a long drive to go to the nearest hospital or the healthcare facility. And it all depends where people live. Are you in a town that does not have a hospital? And maybe you have a visiting doctor that visits once a month for a couple days. Enabling characteristics. Insurance status. Are you uninsured or you have really bad insurance? Are you homeless? Education. How high or low is your education? Prisoners. What kind of setting do they have? How is their environment like? Social, economic. Do they have power and money to influence how their health care can help them? And what is that person's belief? Do they prefer going to a traditional doctor and believe the traditional doctor versus the Western doctor? Or they just don't want to go to a doctor at all? Or they're always going to a doctor? Need characteristics. Mental health, mental illness is very important. A lot of times it's so unseen. Chronic illness, disability. Chronic means continuous. What kind of illness that does that person have that's continuous? Special medical need. What kind of special medical need does that person require? Is it physical? Is it mental? Is it emotional? Is that person unconscious, maybe in a coma? Is that person disabled? How is that person disabled? Is it mental disability or physical disability? And if that person has HIV/AIDS. Framework to study vulnerable populations. So I want you to open your book to page 252, figure 11.1, which is general frameworks to study vulnerable populations. So let's think of someone in the ecological sense. Let's say this person lives in rural America, and this person lives in a farm, and the hospital is probably 2 hours away. This person's elderly, they're not feeling too well, and they really have really bad cough. So you can see all the vulnerability. Living in a rural area, elderly, has really bad cough too. So that brings more vulnerability, because the more factors you have with vulnerabilities from the characteristics that we mentioned in the previous slide, the more vulnerable you are. How are you going to be treated by your access of care? If you have insurance or if you don't have insurance, how's your quality of care is going to be like? So these all should be taken in consideration. And what kind of technology does this hospital have? Is it like very advanced technology, like New York City, since it's a mega city, or does it have very basic technology? So what would be the outcome of this person's physical, mental, and social experience with the healthcare system? Is this person going to be taken care of? How would this person feel afterwards? Is this such a long line to see a doctor that maybe 5 hours before they're able to see a doctor? And how is the social aspect of it? How is this person being treated by society? And then when you look at the population based on this person's vulnerability, all the vulnerabilities that we spoke about, do other people in their group experience the same thing too? What is the outcome of these individuals, these vulnerable groups, these vulnerable population? Are they all kind of being treated the same way based on what they look like, where they came from, where they live, etc.? Framework to study vulnerable populations. What is vulnerability? In healthcare, vulnerability is the likelihood of experiencing poor health or illness. Poor health is compounded with problems along multiple dimensions. So it's not just one issue, you have different issues combined. Vulnerability represents the interaction effects of multiple factors over which many do not have control. So when you think of the characteristics that we kind of mentioned before, predisposing, enabling, need characteristics, can we control all of those? There's a lot of things we can control with those characteristics. Multiple vulnerable traits may lead to cumulative vulnerability. So the more vulnerable traits you have, the more you become vulnerable. Well, you're even more vulnerable. I have a really great video about public health, health of special populations. Remember I mentioned that vulnerable populations or groups are sometimes called special population. This video has a really great explanation about vulnerable populations. See you soon. Remember to read the book.